Healthcare officials are sounding the alarm. Today they answered questions and expressed their concerns directly to state lawmakers. Our Jay Burr at today's meeting. He joins us live from the state capitol. Jay, first of all, how are state leaders planning on addressing the resurgence of COVID?
Well, that was a lot of what today's conversation was about. What can they actually do? In fact, Senator Clark Tucker even at one point asked that very question bluntly. What can we as a legislative body do for you when addressing some of the hospital leaders? But again, several healthcare leaders were here to sort of give an update on what the status of COVID here is in Arkansas. And I do want to point out that this meeting was actually scheduled ahead of what Governor Hutchinson actually issuing that proclamation. So this one was already on the docket. But again, just leaders coming out today saying that this is what the status is. In fact, the numbers provided by hospitals paint a pretty grim picture. And of note, there are only 37 ICU beds available, and that is across the state right now. At Children's Hospital, they have 21 COVID patients, which is actually down slightly, but none of them are vaccinated, and 16 of the 21, they say, were actually eligible for it. Now, when asked about morale, the Hospital Association said many are tired and worn down from the constant workload, and many nurses actually walking away mid-career more so than they have ever done so in the past. And Greg Crane with the Baptist Health System here in Little Rock says they are at the end of their strings.
Monday of this week in the Baptist Health System, there were 54 patients that spent the night waiting on a hospital bed. Approximately 1 in 5 patients in the Baptist Health System are COVID patients. Again, I'm very concerned. I believe you should be very concerned. My staff is worried, and staffing is the issue.
Now, masks also much of the discussion today as legislators peppered Dr. Jennifer Dillahay on that issue, and she bluntly said at one point that she believes masks worn do control the spread of COVID-19 and would actually not be detrimental to the health of children. Obviously, with the governor wanting to call a special session to address the mask mandate and school districts. But Dillahay stressed that masks not the only thing to rely on when it does come to protecting children. Obviously, good hygiene, distancing when possible, and she did stress that vaccinations within households will go a long way in suppressing this virus. And she did mention that the mutation of the virus is what they're really worried about and what they're trying to fight when it does come suppressing. So the frequency or the rate of it mutating, and also the fact that it will mutate in general, because she does say they are worried about any potential mutations where the current set of vaccines may not be quite as effective. So again, a lot was covered today here, and a lot still more to come as the week does go along. Tomorrow they're going over the governor's declaration of emergency, and then later in the week, that special session. But we'll have much more of that as the week does roll along. But for now, live outside the Capitol, Jay Burr, Fox 16 News.
All right, Jay, thank you.